Welcome and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session of today's conference. At that time, you may press star followed by 1 on your phone to ask a question. I would like to inform all parties that today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the conference over to Deborah Rivera. Thank you. You may begin.
Great. Thank you so much, Marcus, for that introduction. Good afternoon, everyone. As Marcus stated, I am Deborah Rivera, your host for today. And I would first like to welcome all of you who joined our Census Academy webinar, our overview of the 2014 panel of the Survey of Income and Program Participation. This is the first of 7 webinars that will be taking place during the month of June, and it aims to give our data users a thorough look into the Survey of Income and Program Participation, from the survey design itself to the many topics that it collects data on. Today's webinar will be an overview, as the title suggests, and it covers the survey content, the design, and processing. And you are welcome to join us tomorrow for part 2 of the SIPP webinar series, where our presenter, Holly Fee, will be covering demographics and residences. And also, as an FYI, we do have course material available for this webinar and tomorrow's webinar on the Census Academy site. So a few housekeeping items before we get started here. We are recording this webinar, and along with the PowerPoint slides, we will be posting that recording to the Census Academy site as a free learning resource. We will hold off for questions until the end of the presentation, at which time we ask that you keep to 1 question. And if you have any questions remaining after that, you're welcome to queue back up to ask again. I would now like to introduce our speaker for today, Mr. Matthew Marley. Matthew Marley is the Chief of the SIPP Coordination and Outreach Staff, and he has been at the Census Bureau since 2008 and has worked on SIPP that entire time in a variety of capacities. Prior to joining the Census Bureau, Matthew received a PhD in Sociology and Demography from Penn State. Thank you so much, Matthew.
Thank you, Deborah. Welcome, everybody. We're really happy that you're here. We're really pleased to be doing this webinar series. We had sort of been planning one, and then Deborah's team reached out to us and asked us if we could do one, and we said, well, why don't we just do a whole series of them? So they got 7, despite only asking for 1. So as Deborah said, today is the overview. This will cover sort of a high level, all different facets of the 2014 SIPP. If you're interested in more specific subject matter, we have a whole series of them coming up throughout the month of June, as you can see here. And tomorrow's will be demographics and residences that Holly will present. So we do have Holly Fee and Shelley Irving on the line. They are also in the SIPP coordination and outreach staff, and they'll be answering questions and handling the chat and things like that. So again, before we get started, the slides are available, as Deb said, on the Census Academy site here. And there are also some supplemental materials that are available as well. There's some sample code. The more topic-heavy webinars will have a lot more supplemental materials. For the opening one, it's mostly just the slides, but there is a little bit of sample code as well. So here's what we're going to cover today. I'll start by talking about the background and the history of the SIPP. I'll give a little overview of the survey and sample design, as well as talking about the content and how we process the data, and then just some things to be aware of when you're using the data. And then we'll finish with some resources for you guys to look at if you have questions or need to get a hold of us after the webinar. So just to start with a little bit of background about SIPP. SIPP's mission is to provide a nationally representative sample that allows researchers to evaluate things such as the annual and subannual dynamics of income. And for SIPP, that really means monthly income. We have income to that granular of a level. You can also look at movements in and out of government transfer programs. You can look at the family and social context of individuals and households, as well as interactions between these items. So SIPP is a really rich data set, and as such, it has a number of advantages. It's got comprehensive, detailed data on a whole lot of different topics, and you'll get a preview of that throughout this webinar. You can also look at the dynamics of different levels. You can look at households, you can look at families, you can look at individuals, depending on your research interests. SIPP is longitudinal over about a 4-year period. The 2014 panel ran through 2017, and SIPP follows movers. And so, again, I'll talk a little bit more about that, but it allows you to sort of see how people's circumstances change over a 4-year period. So SIPP began in 1984, and we ran panels through 1993 with an overlapping panel design. So in other words, the 1984 panel hadn't finished when the 1985 panel started, and so on. Starting in 1996, we converted it from a paper instrument to a DOS-based instrument. And at that point, the panels were no longer overlapping, they were end-to-end. So the 1996 panel ran until 2000, then a new panel started in 2001, and so on. With the 2014 panel, we debuted a totally reworked instrument with different mostly the same content, but some content differences, some significant changes to the instrument and the data processing, and a lot of that's what I'll talk about today. That panel ran through 2017 and has now been concluded. So if you've used SIPP before, if you're familiar with how SIPP used to be designed, you know that there was a 4-month recall period, meaning that we did 3 interviews of each household per year. We were always in the field, so the sample was divided into 4 rotation groups, and each of those rotation groups was interviewed monthly. There were some questions that were asked every interview, and we refer to that as core content, and then other questions that were asked less frequently on very specific subject matter areas, and those are what's referred to as topical module content. But with the current SIPP, we've redesigned it, so now it's an annual interview, so we're asking people about the previous 12 months instead of the previous 4 months, and we have introduced an event history calendar to sort of help with respondents' recall. And here's what that looks like. We'll be talking about the event history calendar a lot. We'll also refer to it as the EHC. And so here's just to give you an idea of what that looks like. And you can see that there are months along the top, and there are topics in each row. And really what this allows you to do is to go through the interview in any order that makes sense for the respondent. So if, for example, we're talking about the residence history, and we're going to ask about the full year's worth of residence history, and the respondent says, I moved in June. Oh, that's because I got a new job. The field representative or our interviewer, those are the same thing, can immediately then go down to the jobs line because the respondent has started talking about their jobs and collect the job information right then. And similarly, if the respondent says, oh, I changed jobs and that caused my health insurance to change, again, they can come down here to the health insurance line and start entering that information right away. Now, in practice, people do tend to go through the event history calendar from top to bottom, and we usually start in December and work back because December is the most current month. However, most people do go through it fairly linearly. But anyway, this is just to give you an idea of what we're talking about when we talk about the event history calendar. So the scope of the redesigned SIPP is very similar to what it used to be with SIPP Classic. It's definitely broader than core, but and it includes a lot of the topical module content. And here's just a table that kind of summarizes those differences. Again, now we have a Windows-based instrument instead of a DOS-based instrument. We still conduct the interviews via personal visit with a little bit of telephone follow-up. That hasn't changed. We now interview annually instead of 3 times a year, and therefore we're asking about the previous year instead of the previous 4 months. Panel length is about the same. We're anticipating roughly 4-year panel length. Sample size is a little bit larger. In the 2014 panel, we interviewed about 53,000 households. The survey universe is still the civilian non-institutional population of the United States, and I'll talk a little bit more about what that means in a minute. There's still very comprehensive content, but the file structure is now much more simplified. And for those of you who have used SIPP in the past, that's a huge improvement. You are probably well aware of how frustrating SIPP used to be to use because you had to keep joining a bunch of files together. Now it's a much easier process. We won't talk about it much in these webinars, but you should be aware that in between waves 1 and 2 of the 2014 panel, we ran a supplement on behalf of the Social Security Administration. And that supplement collected additional data about marital history, pension receipt, and disability. So if you happen to be interested in those 3 topics, I would certainly suggest that you also look into data from the SSA supplement. And that data, along with all of the SIPP data, is available for download at the Census website, or the SIPP website, which is census.gov/SIPP. Okay, so I'll talk a little bit more now about the way that the survey is designed and the way that we design the sample. So I mentioned before that the survey universe is the civilian, non-institutionalized population of the United States. So civilian means we don't include people who are on active duty, and non-institutional means that if you're in prison or other sort of institutional group quarters like that, you're not included. And that's mostly because it's hard to get access to interview those people. It's also hard to follow them, and because SIPP is longitudinal, we are generally trying to follow people. You should also be aware of the way that we treat infants, and infants are defined as people who are younger than 1 year old at the time of the interview. They're listed on the roster, and they're available to be selected on other household members' questions. So if, for example, we're asking mom about her health insurance, and it says, there's a question that says, who else in the house is covered by this health insurance policy? She can select the infant on that, but we won't ask the infant about the infant's health insurance directly. The design of the sample, our sample is based on the 2010 decennial census frame. The 2014 SIPP was actually the first Census Bureau survey to use this updated frame, and that is drawn from the Census Bureau's master address file, or the MAF. And along with other surveys, when we pull addresses out, then they're out of consideration for 5 full years. So in other words, if you're selected to be in SIPP, you won't be selected to be in the current population survey or in similar household surveys for at least 5 years. And that's just to avoid having respondents get overburdened with multiple surveys at the same time. That is rare, but it can happen, and so we do this address unduplication here. So the SIPP sample is constructed as a 2-stage stratified sample, the first stage being that we select primary sampling units, and then the second is that we select addresses within the primary sampling units, or PSUs. So what is a PSU? Well, a PSU is a county if the county has at least 7,500 people. If a county has fewer than 7,500 people, then it's a combination of contiguous counties. And we have 2 kinds of primary sampling units, self-representing and non-self-representing, and I'll explain what that means in a second. But here's a visual example of what a primary sampling unit is. You can see that this is Wyoming. These are not the actual primary sampling units, but this is just an example. So you can see that each of these counties that is above 7,500 people is its own primary sampling unit. So Park County here with about 8,000, Teton County with about 15,000, and so on. And then ones that are below counties where there are fewer than 7,500 people get combined. And so you can see that this primary sampling unit is a combination of 3 counties, this is a combination of 2 counties, and so on. And the color coding means that the purple are self-representing and the white are non-self-representing. And what that means is that self-representing PSUs are guaranteed to be included in the SIPP sample. Non-self-representing PSUs may or may not be included. Basically, we stratify them and then they're selected with a probability according to their size. And what this means in reality is that the 2014 SIPP contains a big chunk of 344 self-representing and 476 non-self-representing. And that means we're in about a third of U.S. counties, and because of the way the population is distributed, that third of the counties covers a majority of the U.S. population. So continuing with our visual example, again, you can see that here are some demonstration PSUs in Wyoming. Again, the purple ones, because they're self-representing primary sampling units, are guaranteed to be included. And then the ones that were in white were the non-self-representing, meaning that they may or may not be selected. And so in this example, you can see that we've selected cases in the green primary sampling units and did not select cases in the white ones. So once the primary sampling units are selected, then we select addresses within each of those areas. And we stratify the addresses by income and poverty status. And the idea with doing that is because we want to oversample in low-income areas so that we can increase the number of poverty cases in the sample. Because much of what SIPP measures is related to income and poverty. Therefore, if we have more cases that are likely to be in poverty in the sample, we're more likely to get good data for those cases. And so all of that provides our final household sample, which was, again, about 53,000 housing units in the Wave 1 of the 2014 panel. I mentioned that we oversample in poverty areas. And so how we do that is using American Community Survey, or ACS data. We rank the housing units in each primary sampling unit into high-income and low-income areas, and then select addresses within those areas. And basically that gives us low-income housing units at a higher rate. And so we got about a 28% increase in cases at or near the poverty level in the 2014 SIPP. You should know that SIPP's estimates are designed to be nationally representative and state representative. PSU borders do not cross states, so all of the sampling is done within the state. And in some states where we had a relatively small sample, we added sample to increase the reliability of estimates from those states. So ultimately, it is representative for, the 2014 panel is representative for all states. That's not true of earlier SIPP panels. So if you're looking to do state-level research, be sure and check the documentation for that. But in 2014, you'll be fine. So what does the sample of SIPP look like? Well, it generally follows the distribution of the U.S. population. And because the population in the United States has more people in metropolitan areas, we also sample more in metropolitan areas. And in rural areas, we try to get about 25 cases per non-self-representing primary sampling unit. And to compensate for the way that the sample is designed, therefore, we have weights that we include in the data set. And basically, weights are the number of units in the population that the responding unit represents. So in other words, if we sample 1 out of 2,500 households, then the weight for each household would be 2,500 to indicate that that household really represents 2,500 households in the final population. And again, we try to make it representative of the survey universe, which, keep in mind, is the civilian, non-institutional population of the United States. So it won't quite match if you looked at, for example, American Community Survey data, which covers everything. Our estimates won't match that because our survey universe is slightly different, but they'll be very close. So we have to use weights, or we suggest using weights, because otherwise you're going to have estimates that are somewhat biased. And that's due to several factors, including the sample design, which I just described, the oversampling of low-income cases, as well as differential non-response. And differential non-response means that different group members respond differently. And that can be geographically. So, for example, people in the Midwest are more likely to respond than people in New York City. It's also age. Older people are more likely to respond than younger people, and so on. And so the weighting design compensates for all of that. And we do provide weights at the person level, and from that you can create weights at the family or household levels, depending on what your research question of interest is. You can also get weights at multiple time frames. We have monthly weights. The December weight you can also use as a calendar year weight. And then finally, in Waves 2+, we have a panel weight. So again, you'll want to choose your weight based on what your research question is and how you're designing your study. But really, for whatever you're doing, there should be a weight that fits your needs. And the way we construct the weights, here's sort of a graphical representation, and I'll walk you through that in a minute. But essentially, you start with the base weight. It gets adjusted by various things, and ultimately, each of these areas represents an adjustment, and then ultimately you get to the final weight. And so we start with the base weight, and the base weight is what I mentioned a second ago, which is the inverse of the probability of being selected. So if, for example, a county has 50,000 households and we sample 20 of them, Therefore, each one is going to have a weight of 2,500, representing the fraction of the population that got sampled. Then we adjust the base weight. So first there's duplication control factor, then there's a non-response adjustment, and then there's a second stage adjustment. The duplication control factor means that occasionally when we get to a sampled address, we find out that instead of the one housing unit there are multiple. So if, for example, we thought it was a house and it turned out to be an apartment, we would need to subsample to make sure to get only one interview for that sampled address. But because you do that, that will then change the household's probability of being selected, and so the duplication control factor adjusts for that. Again, that's relatively rare, but it does happen, and so therefore we have to adjust for it. Next, we have a non-response adjustment, and that adjusts for what I said a minute ago, which is that not all households that are eligible are going to be interviewed, and they're not going to be interviewed. The non-interviews don't happen at random. They vary from group to group. So in this example, continuing what we had said before, we sampled 20 households in that county. If only 16 of them responded, then they got adjusted by a factor of 20/16. So instead of the base weight of 2,500, then it got adjusted to 3,125. And this example sort of implies that the missingness is at random, but as we've discussed, it's not. So we do some additional non-response adjustment to account for that. The final adjustment is the second stage adjustment, and the second stage adjustment means that we want to make sure that our estimates agree with independent monthly estimates of the population. And so for Census Bureau, the things that we look at are, among others, state, age, race, sex, Hispanic origin, family relationship, and so on. And this adjustment is actually done at the person level rather than at the household level because, of course, a household can have people with a mix of these characteristics, so it's not really possible to do that at the household level. Anyway, after all of that adjustment, you get your final person weight, and that's what's available to you on the file. And as I mentioned, from the person weight, you can then derive a household or a family weight depending on the needs of your research. So from those things, then we have a sample and we're ready to go out into the field. And once we do that, here's kind of an overview of what we ask respondents and what we collect. But before we get into that, I want to go over a few definitions just to sort of make sure everyone is on the same page and that when I refer to these concepts, they'll make sense to you. So first, we have a respondent. And a respondent is simply somebody in the household for whom SIPP collects information. And for SIPP, that's basically everyone in the household, everyone who's actually living there. If you're just there visiting, you won't get counted as a respondent. But if you live in the household, you'll be a respondent. Specifically, there are also household respondents, and household respondents are the first eligible adult household member who is interviewed. And that's often the same, but can be different from the reference person. And the reference person is the owner or renter of the housing unit. And if there are multiple people on the lease or multiple people on the mortgage, it's the first of those people that we talk to. The reference person is an important concept because a lot of the subsequent questions are asked only of the reference person, or they're asked about other people in the household in relation to the reference person. So just keep in mind that that's the owner or renter of the housing unit. Type 2 person, this is something that is new to the 2014 SIPP, and a type 2 person is someone who lived with a respondent during the reference year, but is not living there at the time of the interview. So if, for example, you had a roommate over the summer, and the roommate's no longer there, the roommate would be a type 2 person. We're not going to interview the roommate. We're going to collect very minimal information about this person. The important distinction is that a type 2 person does not have a person record. They are on the information of the person we did interview who reported the type 2 person. They do not have their own records in the data set. And also keep in mind that because we collect a year's worth of residence history for each respondent, a type 2 person could have lived with the respondent at any address where the respondent lived, not just the address at which they got interviewed. So again, using the example of the person having a roommate earlier in the year, let's say the respondent had actually lived at in a dorm or at the house with the roommate, we would collect that information, and then the respondent moved to the interviewed address, and there are no type 2 people there, but there were at the previous address. So for a lot of research, you may or may not be interested in what the type 2 person is doing, but for a lot of research that involves family dynamics or income or anything like that, you'll want to include the measures with the type 2 people so that you're getting a fuller sense of the household's economic and social circumstances. SIPP defines adults as anyone 15 years or older, and so keep in mind that a 15-year-old child who's living in the house is going to get asked questions about fertility, is going to get asked questions about employment or marital history. And for a lot of 15-year-olds, they're not working, they're not married, so it's not relevant to them, but sometimes they are. So even though people tend to think of adults as 18 or older, keep in mind that for SIPP, they're defined as 15 years or older. SIPP, like the Census Bureau in general, defines family as a set of people related by blood, marriage, or adoption. And a household is defined as a set of people who are living together. And then the next definition is self versus proxy, and you might hear us refer to these kinds of interviews throughout the webinars. Basically, a self-response is that the respondent is providing information for him or herself, and a proxy response is that another adult in the household is providing information for the respondent. So if we go to somebody's door and it's a married couple, husband and wife, only one of them is home, that spouse can report for the spouse who is not home. And for all children, i.e. everyone under 15, those interviews are all done as proxy interviews. So adults are always providing child's interview information. We never interview children directly. And finally, we have a coverage unit, and this is also known as a program unit. We will use those terms interchangeably. And that's a set of people who are covered by a health insurance policy or an assistance program. So for example, your food stamps may cover you and your child, or you and your spouse and your child. Whatever group of people is covered by those food stamps is referred to as the coverage unit. And similarly with the health insurance policy, whoever is covered by that policy is part of the coverage unit. So that could include one person, it could include some of the people in the household, all of the people in the household. It may even include people in the household, as well as, a health insurance policy might cover, for example, a kid who's away at college. That kid would be part of the coverage unit, even though they won't be interviewed as part of SIPP. So now that we have those definitions out of the way, here is a high-level overview of what the survey asks of respondents. And we'll go through, the subsequent slides have this in more detail, but we start by collecting a roster with everyone in the household, and we collect their name, their sex, as well as their birth date. We collect demographic information about each person, and that's the standard Hispanic origin, race, citizenship, language, English speaking, and so on, their marital status, and additional demographic information. Then we get into the event history calendar, like I showed you before, and that covers a variety of topics, including residency, marital history, educational enrollment, jobs, as well as time spent not working, program receipt of a variety of assistance programs, and health insurance. After we complete the event history calendar, we have some follow-up questions for health insurance, some additional questions about kinds of assistance such as dependent care, non-job income, other income that you might have received from programs. We have some detailed questions about asset ownership and household expenses, and then we ask some questions about healthcare utilization, medical expenditures, disability, fertility history, and then some child care and adult and child well-being questions. And then finally, we close out by asking about contact information for each person, because we're going to interview them again the following year, as well as whether they intend to move. And of course, not everyone knows that they're going to have moved by the time the next year rolls around, but if we know that they are planning to move, that will help us locate them when we go to find them a year later. Okay, so here's some more detailed slides that show the questions for each of the subject matter areas. So we start with demographics. And again, in demographics, we collect a roster of all the people living in the household. We then collect a roster of the type 2 people, which you'll remember are people that lived with you during the year but are not currently in the household. Some standard demographic information about each group, about each person. We collect detailed information about household relationships, including options for same-sex partners and spouses, and then things like marital status, and then a brief marital history of people. So the year that they entered their current marriage, the number of times they've been married overall, whether they've been widowed or divorced, and so on. Next, we ask for all children in the household, we ask a gender-neutral parent identification so that, again, you can identify same-sex parents or opposite-sex parents. Basically, it points to parent 1 and parent 2. The type of parent, so whether it's a biological child, a foster child, an adopted child, a stepchild. For each person, we collect some nativity and citizenship information, some educational attainment information. Later in the event history calendar, we'll collect educational enrollment. That's current educational enrollment. But here in demographics, we collect educational attainment, as well as things like educational certificates, professional certifications and licenses, and so on. And then we collect some information about people's armed forces status, whether they're veterans, whether they're on active duty, and so on. So after demographics, then we get into the event history calendar. And this is the same graphic I showed you a little while ago. Again, the months across here, so we'll try to fill in each of these months for each of these topics. And of course, not every topic will have coverage in every month. For example, you might have only been on food stamps for a few months. You might have had health insurance for part of the year. But for a few of them, marital history will collect the whole year's worth, and residences will collect the whole year's worth. Because even if you didn't have a fixed address, you were living somewhere during the year. So we will collect that information. So again, for residences, we'll collect up to 5 residences for each person. For each of those residences, we'll collect the tenure status, meaning did you own or rent the house. And then we ask whether you received any public housing assistance, whether you got a subsidy, whether you got a voucher. We ask why you moved to the address. And then for the address that began in January, we'll ask when you moved into that address and what your tenure status of the prior residence was. And that will allow you to look at tenure shifts. So did somebody go from renting a house to owning a house and things like that. So for mobility researchers, there's a tremendous amount of information here. The next topic in the event history calendar is marital history. You can report up to 3 spells during the year. And what that will give you is monthly marital status with a pointer to the spouse if the spouse is in the household. Cohabitation status if you're not married but you had a partner in the household. And then the registered domestic partner, if you're cohabiting, you can say that you were in a formal registered domestic partnership. Next is educational enrollment, and you can report up to 3 spells there. And for each of those spells, we will collect the grade that you were attending, the type of school you were in, so public, private, and so on, whether you enrolled part-time or full-time, whether you had to repeat a grade, and for kids who are 7 and under, whether they were in Head Start. After educational attainment, we go into the labor force section, and this is a very thorough section, as you can see. And we collect information about up to 7 discrete jobs, and you can report up to 2 spells working in each of those 7 jobs. And if you happen to have more than 7 jobs, you can fill in a timeline of additional work. So for the jobs beyond 7, we don't collect information that's as detailed, but we at least collect when you were working in those jobs. But for each of the 7 jobs, we do collect the kind of pay that you got as well as the amount, your earnings if it was a job, or your profits or losses if it was a business, how many hours you worked per week, whether those earnings or hours changed, and we can collect up to 3 changes, the industry, occupation, and class of worker, the kind of information, some information about your business or if you have an employer, and that's things like the address and the size of the business and so on, whether the person was in a union, whether the business was incorporated, and then whether you had any time away without pay if you were looking at gaps in people's work history. For people who aren't working, we collect spells of time out of the labor force or time not working. And those are separate because you could be out of the labor force in that you were going to school or you were retired, or you could be in the labor force and looking for work. And so we ask some questions to differentiate which of those two groups people fall into. We ask why they weren't working, whether they were available for work, and if not, what their reasons were. For each of those jobs, we also collect information about people's commuting and work schedule. So for commuting, we ask how people got to work, and you can report multiple modes. So if some days you take the bus, other days you drive, you can report that. We ask how long it took you to get to work, as well as how far it is, and about some costs. And then as far as work schedule goes, we ask which days of the week that you worked, when you started and stopped each day, whether you work from home, and what kind of schedule. And the kind of schedule is daytime, nighttime, shift work, and so on. After we're finished with jobs, then we move into the programs section of the EHC. And the EHC collects data on multiple programs, as you can see here. So that includes SSI, or Supplemental Security Income, TANF, Temporary Assistance for Needy Families, Supplemental Nutrition Assistance Program, SNAP, which is also known as food stamps, General Assistance, and WIC. And for each of those programs, we collect up to 3 spells. We ask who in the household is covered, as well as who owns the coverage, and those can be different depending on the way it's set up. So for example, perhaps you get food stamps, but you're not covered, but your children are. So you might own the coverage, but you're not covered. And so these questions help differentiate that. We ask why you started and stopped receiving the program, as well as the amount that you received. After programs, we have some health insurance related questions, and we ask these questions separately for private health insurance, Medicare, Medicaid, military health insurance, and any other coverage you might have had. And similarly to programs, we ask for each health insurance policy who in the household was covered, who owned the coverage, whether anyone outside the household was covered, what type of coverage it was, so whether it was an HMO, a PPO, or so on, how much it cost you, and whether it was a public or private plan, and what kind of deductible that you had. And for Waves 2+, we've added some questions about the Affordable Care Act. So we asked whether people obtained their health insurance coverage via a state exchange, and a couple of other questions. But that started, keep in mind that started in 2015, so it's not on the Wave 1 file. So after we're finished with health insurance, that wraps up the event history calendar. After you exit the event history calendar, you get some health insurance follow-up questions. These help to reconcile any time that people had without coverage. If they were employed but they didn't have private coverage, we'll ask what the reasons were for that, as well as any other reasons they weren't covered either by public insurance or by no insurance at all. So after the health insurance follow-up questions, then we have some additional questions related to annual programs, and these are various types such as Social Security income, VA benefits, workers' comp, unemployment comp, energy assistance, whether you were or your children were enrolled in free and reduced price lunches or breakfast or lunches at school, whether you received any other of these kinds of income here, whether you got child support, alimony, and so on. And then finally, some follow-up questions about other kinds of non-cash assistance, cash and non-cash assistance, such as training, food, clothing, housing, and so on. After the program section, the next section of the instrument involves assets, and the assets ask both similarly and jointly. We collect jointly, meaning you own it with your spouse or with somebody else. For each of those, we'll ask balances and values for all of these kinds of assets. So everything from checking and savings accounts to mutual funds to stocks to retirement income, and then some less common kinds of assets such as royalties, mortgages that you have as an investment. So very detailed assets questions. And then we ask some questions about other kind of non-financial assets such as real estate, vehicles that you own. We collect information about up to 3 vehicles in the household, and we ask about the newest vehicles because those are most likely those are the more valuable vehicles that you would own. And then if you own a business, we'll ask about the value of the business and any debt that the business has, as well as retirement balances and any unsecured liabilities, which are things like credit card bills or medical bills. We also ask more generally about medical expenditures, and those include things like your out-of-pocket expenses, as well as how you utilized health care. So did you go to the doctor? Were you hospitalized? How many sick days you had to take in the previous year? What kind of insurance premiums you faced? And if you were uninsured, whether you were able to go to the doctor at all. We do ask some disability questions, and these questions are consistent with disability items that are on other Census Bureau surveys, so you may be familiar with them, even if you're not familiar with SIPP. So everybody gets asked whether they have some sensory disabilities, which are problems with seeing and hearing. Adults get asked these questions here, so problems with concentration, with memory, and so on. And then children get a similar but slightly different set of questions, again, concentrating and memory, but then also do they have issues with playing with similarly aged children? Do they have issues doing their schoolwork? And then very young children get a question about developmental conditions or delays. And I mentioned at the beginning of the presentation, we did a supplement on behalf of the Social Security Administration, and that supplement does include detailed questions about adult, child, and work disability. So if you're a disability scholar, the SSA supplement is probably a very good resource for you to use in conjunction with SIPP data. After disability, we move into asking about fertility. So we collect a complete fertility history of all adults in the household. And so we get the roster and ages of children who you've given birth to or you've fathered. And what that enables you to do is construct a measure of multiple partner fertility. And that's something that is not available in most other surveys. This is a real strength of SIPP, is that you have this indicator of multiple partner fertility. You also get an indication of whether the respondent is a grandparent or not. And then for each respondent's biological parents, we ask them questions about their nativity and mortality, including the country of birth and whether they're still alive. Then we move into asking for each child in the household about their child care, and so we ask what kinds of arrangements, and then for each kind of arrangement, which child or children use those arrangements, how much you had to pay out of pocket, whether you received any assistance with those costs, and whether you had to lose any time from work because of your child care. And then the final set of questions are about well-being, and these are different whether the respondent is a child or is an adult, but so children get the battery of questions about whether they had dinner with their parents and whether they were engaged in school and so on, and adults get questions about the environment. So was the neighborhood unsafe? Was it noisy? Does the housing unit have problems with pests? Does the plumbing have problems, or does that household have any problem with their ability to pay the mortgage or the utilities? And that leads into the food security questions, which are, again, a sort of standard battery of questions that you may have seen on other surveys. And they ask whether the household was able to buy enough food, whether they were able to eat balanced meals, or maybe they had to cut back on their meals. And if so, how frequently, and then did adults defer food to the children? So those are all the substantive kind of questions that we ask. of course, at that point, we've been in the respondent's house for a while and they're ready for us to leave. So we have a few follow-up questions here, just sort of asking, again, I mentioned earlier, about moving intentions, and we get some contact information for other people that might be able to tell us where the respondent is if we can't find the respondent. So then we close out the interview. And so at this point, we've collected data for the household. And once we get the data back to headquarters, then we have to process it before we can get it out to you guys so that you can analyze it. And in order to do that, we have to do a number of things, and I'll sort of walk you through what those are. So with the 2014 panel, besides a fully redesigned instrument, we also fully redesigned our data processing system. And that took a tremendous amount of time and effort on behalf of our subject matter analysts and our programmers, not least of which was that they had to convert the editing programs from Fortran to SAS, which sounds straightforward, but was a tremendous effort. But the basics of our strategy and our processing strategy do remain the same. And that strategy is mostly what we want to do is item-level imputation. So that occurs when a respondent might be in universe for a given question but has not provided an answer. And that could either be because they don't know, it could be because they refuse to answer, or it could be there was a technical glitch and they just didn't get the question. That's relatively rare. It's much more likely that they don't know, especially with a proxy interview, but it could also be that they've refused because they don't want to tell us. But we need to fill in that missing information. And so we do that via one of three ways. We can either do logical imputation, hot deck imputation, or cold deck imputation. And these are listed in order of preference. So we would prefer to do a logical imputation. And that simply means that we use the respondent's answers to other questions, related questions, to derive the answer to the missing value. So for example, this is not a real example, it's an oversimplification, but here's an example. Let's say the respondent has 3 children, and for the middle child, for whatever reason, they didn't tell us where the child was born. But for the other 2 children, they said that their kids were born in Texas. So logically, the missing value may get set to Texas. That's not foolproof, but it's pretty good given people tend not to move, and so it's a pretty good bet that the missing value is Texas. We also do use this method to edit provided answers for logical consistency. If, for example, the respondent says they were born in the United States, but they're not a U.S. citizen, that's not possible. That's logically inconsistent, and so we would most likely set them to have been born in the United States and to be a citizen. So that's logical imputation. If for some reason we can't do logical imputation, then we'll move to hot deck imputation. And hot deck imputation uses an answer provided by a very similar respondent to a missing value. So if, for example, the respondent doesn't tell us whether they owned or rented their house, but similar respondents do tend to own their residences, we may set the missing value to owned. And similar respondents are matched on a variety of characteristics, usually demographic characteristics such as age, race, educational attainment, and so on. And this has the advantage of that the missing data will reproduce the distribution of the reported data, so we're not going to skew estimates with this imputation method. And finally, if the other two don't work, then we will use cold deck imputation. And cold deck imputation just uses a default value to be inserted into the missing value. We don't really ever want to do this, but we do have it there as a last resort. And the cold deck value usually is just the most common answer for the question. So again, if it's owned or rented, most people own their houses, so we would use that as the default answer. So these methods work when you've got a single missing item, but what happens when there's an entire person who's missing? And in that case, we have to use whole person imputation. And in previous SIPP panels, we would just take a similar person, again, matched on various demographic characteristics, and just take all of that person's information and substitute it for the missing person. if you've used SIPP before, you may have heard that referred to as type Z imputation. That's the same thing. However, that's a fairly crude method of imputation. And so for 2014, we've refined that and we've replaced the whole person imputation with model-based imputation. And basically, this uses statistical models to provide some missing data for the respondent. And the models are constructed using fairly sophisticated techniques that our methods area has developed. And it's a combination of survey data and administrative data. And essentially what that allows us to do is to bring in data from outside the pool of survey respondents. So instead of just trying to model the data with the relatively small number of SIPP respondents, we can model it from a much larger population, and therefore the model is more precise. However, that leads to a problem. How can you create models when you're trying to get data out for a survey that has 11,000 variables? There aren't that many variables on the public use file, but for the imputation to work properly, that's the number of models we'd have to come up with. Well, if we were to do that, we'd be creating models from here until kingdom come. So we decided we're not going to create 11,000 models. What we're going to do is model what we call topic flags. And essentially, topic flags are indicator variables for each of the major topic areas that we cover. So the model will say, yes, this person had a job, or no, this person didn't have a job. And then we can use the regular logical and hot-deck imputation on the more specific questions. A little bit more about topic flags. So as you've seen, the instrument is divided into different subject areas. And at the beginning of most of those subject areas, there are one or two screener questions that determine whether the respondent should be asked the more detailed follow-up questions for that topic. So for example, at the beginning of the job section, the first question is, do you currently have a job or business? And if the respondent says yes, great, then they go into the detailed jobs question. If the respondent says no, I'm not currently working, then the next screener question says, okay, did you have a job or business at any time during 2013? And again, if the respondent says yes, then they go into the detailed follow-up questions. If they say no, then they move to the next section. So what the model then does is it tries to just fill in this. And so what we see when we look at the topic flags are they're set to 1 if the respondent had a job, they're set to 0 if the respondent didn't have a job, or they're missing if the respondent skipped the topic entirely. And it's these missing values that the model will try to fill in. And so what that does is it lets us stop whole person imputation. It also preserves the correlation across topics because you can estimate a joint distribution. And what that means is if you're missing, say, both job and health insurance information for people, those two things are often connected. And so by having the model take both of those things into account, the estimates will be more precise, and you can estimate the likelihood of health insurance contingent on whether the person had a job or not, as opposed to just imputing them separately. And if you do that, then it doesn't look like there's any relationship between those two, even though we know that there is. And so the advantage is that then we're only imputing a relatively small number of these topic flags, and then they can be used in the downstream edits. So the topic flag, then whatever value is imputed there, if it's set to yes, then the item level imputations can then set the values, the missing values for the detailed follow-up questions, and if it's set to no, then we can just go to the next subject. So basically, here's a list of what topic flags get imputed. So within the event history calendar, it's educational attainment, whether the person worked or not, whether the person received each of these assistance programs or not, and then whether the respondent had each of these types of health insurance or not. And outside of the EHC, the model will impute things like whether the respondent had any children, yes or no, whether they were disabled, yes or no, whether they were receiving retirement income, yes or no, and so on. So essentially, it is a series of yes/no questions that the model predicts. And here's just an example of what this looks like. So of the people who were in universe to be asked about whether they worked for pay, about 95% of people responded to this. And of those 95%, about 58% said yes, they worked, and about 42% said no, they didn't. And you can see that that lines up very, very well with administrative data that we get from the IRS. Even though it's lagged a year, these IRS data are for 2012, and we were asking respondents about 2013. You can see that it's very consistent. The percentages are almost dead on. For the 5% of people that did not tell us whether they worked or not, in other words, they should have answered the question but did not, you can see that the model imputes about 62% of them to have worked for pay and about 38% who did not. And again, that lines up well with the administrative data, but if you're comparing it to the reported percentages, you'd say, well, the model is overestimating people that work. Well, the reason it does that is because of differential non-response. So in other words, people who do work are less likely to tell us about their jobs or their lack of jobs than people who are not working. So in other words, if we were just using logical imputation, we would have reproduced this distribution, but the model is a more precise distribution of the people that should have responded because it lines up better with the administrative data. So we've done a number of these evaluations, and the model definitely produces more precise results. So we think this is a big methodological improvement within the 2014 SIPP. And we're happy that we've managed to expand the processing system to include this. So besides the topic flags, another kind of flag that we create in the processing system are status flags. And if you've used SIPP before, you may have heard these referred to as allocation flags. They're a similar idea, but now they contain a lot more information. And so for each of the variables in the data set, you have a matching status flag, and it's denoted by an A in front of the variable name. So for example, the e-tenure variable, which indicates whether the person owned or rented a household, there's a corresponding status flag called A-tenure. And that's the same for every variable in the data set. Every E variable will have a corresponding A variable. And there's a lot of information in the status flags. You can see maybe the person just wasn't in universe for a given question. Maybe they were in universe and we took the reported data. Maybe we had to impute the data, or maybe, especially for recodes, it's a combination of these. And so these 7 to 9 are used for our recodes, and I'll talk a little bit more about recodes a little later. Anyway, so you can get a tremendous amount of information using the status flags. And then the final kind of flag that we create in processing is what we call a continuation flag. And you need a continuation flag because in the event history calendar, we collect data through the month of interview. So if we interview you in March and we're asking about the previous calendar year, we're collecting data from January of the previous year through March of the current year, so 14 or 15 months. But we're only releasing the data through the end of the reference year, or 12 months. So as a result of that, you just looking at the data aren't going to know whether the person's spell ended in December or is ongoing. And that can be important. If you're looking at something like jobs, you need to know whether the job really ended in December or if it's ongoing. And so for each of the December months in the event history calendar content, we do provide these continuation flags. And what these show is that the spell either ended in December, whether it ended after December but before the interview, or whether it was ongoing as of the time of the interview. So you can use these to see, especially if you're doing like a survival analysis or an event history analysis, you can use these continuation flags to see whether the person encountered the event. Okay, so at this point, all of the processing is done, and now we've released the data. And so I want to go through a few things that you should know as you're working with the data or as you're getting ready to work with the data. So keep in mind, it's important to keep in mind what SIPP is good for and what it's less good for. So SIPP is very good for generating monthly national level estimates as well as in the 2014 panel state level estimates. It's good for annual estimates. It's good for longitudinal analysis over the length of the panel, keeping in mind that the panel is a 4-year panel. And because we oversample in high poverty areas, SIPP is very good for analyzing income and other economic circumstances of poor people. It's not as good for long-term longitudinal analyses. Again, the panel is 4 years long, so it's not going to cover anything before or after the 4-year period. And it's not as good for analyzing data at the top of the income distribution because we don't have nearly as many wealthy or high-earning households in the sample as we do poor households. So just keep that in mind as you're thinking about your research question and thinking about how to use the data. Just a few tips. Our data sets are provided in SAS and ASCII format. They're available on the SIPP site and on the FTP site. Starting with the 2014 panel, we've started making the files also available in Stata format. We know that a lot of people are now using Stata, and so we're trying to make the files available in user-friendly formats like that. If you have a SAS file and you want to convert it to Stata and you don't have a tool like Stat Transfer, this website that UNC maintains is a good tool for moving data sets from SAS to Stata, and they've got a parallel command that goes in the opposite direction. Keep in mind as you're using the data set, SIPP has a lot of variables and a lot of observations. Because it's a person-month file, keep in mind that each person has 12 observations, and there are about 2,500 variables on this public use file, plus 2,500 corresponding status flags. So the file is large, and depending on your machine, that can lead to significant memory limitations. So it's definitely worth working on a well-equipped machine if you have access to it. And when you load in a data set for speed and performance reasons, we definitely recommend that you keep only the observations and variables that you need so that you're not executing your commands over a much larger data set and slowing yourself down. We also recommend that you keep your complete SIPP files in their original state and don't change or save on them, save any subset files you need as separate files rather than updating your master files. We recommend that you create a single SAS program or Stata do file to construct the data set, and then of course you can always just reconstruct it as you need to. Just a few best practices. Again, you want a permanent set of program or do files for your analyses. First, you can have one that constructs the data set, then you can have one that constructs the variables, and then finally you've got some analyses that you can run. And if you do this, of course, it will make it a lot easier for you to add variables to your data set or take them out. It's much easier to find mistakes because debugging is simplified a lot. And then, of course, if you need to rerun your analyses, you can just do that pretty quickly. I talked a little bit before about the variable scheme, and so it's very useful to keep in mind if you're looking at the data how the variables are named. So E-variables are simply edited versions of reported variables. And so those are things that we ask and respondents answer directly. So tenure, did you own or rent the house, sex, or male or female, and so on. The A variables are, again, the status flags that I mentioned, and again, keep in mind there is a status flag for each of the variables. You may also see variables that start with T, and those variables are top or bottom coded if they're continuous variables, or they're collapsed if they're categorical variables. And this is usually done for confidentiality or disclosure avoidance reasons. So for example, age is top-coded because there aren't many people above, say, age 90 in the SIPP panel. So everyone above age 90 is top-coded. I think we top-coded age 88 or something like that. So that's a continuous variable that gets top-coded. LIV, is living quarters type, and this is a categorical variable that is collapsed because most people live in type value of 1, which is house, apartment, or flat. And so for the other types, which are everything from a trailer, or it could be an unoccupied tent site where you were camping for a while or whatever. Those get collapsed down because there aren't that many people who fall into those categories. The final kind of variable are recodes, and those are denoted with an R. And recodes are variables that are not directly asked of respondents, but they're created during processing from other variables. So this is a language isolation recode, which measures how well respondents speak English. The R mover recode is created from the residence history information and indicates the kind of move that a respondent undertook. So whether they moved within a city, across a county line, across a state line, and so on. So the recodes provide a lot of additional information that, again, we don't collect directly from respondents, but that we can derive. Also keep in mind when you're using the data that you may need to identify unique respondents, and this is because it's a person-month file. There are 12 observations per person per wave. And so you'll need to have a person identifier, and you can do that here. And then you can very quickly, if you are only looking at December, for example, very quickly drop the other 11 observations for that person. But this will allow you to identify those people. And then in subsequent webinars, we'll discuss how you can identify families because they're not noted directly in the file. I mentioned you want to keep only the observations that you need. If you're looking at individuals, you want to keep all the respondent observations, but you may only need one per person, or you may need all 12, depending on the kind of work that you're doing. If you're looking at households, you probably only want to keep one observation per household. And again, you probably want to use the head of the household or the household respondent, and you can figure that out by using the relationship question that we'll discuss more in the demographics webinar. Again, we'll discuss creating families, but here's sort of a very high level. We recommend that you keep one observation per family. The advantage is that for household and family level variables, we record those on each of the sample members' observations, so it makes life a lot easier. So every member of the family will have the same value for these variables, or every member of the household. Because SIPP is longitudinal, you should also think about how you're going to follow people across waves. So in the survey, basically everybody who's there in wave 1 is considered an original sample person, or OSP. And in subsequent waves, we will attempt to interview every OSP as well as any new people who have moved in. So if, for example, in wave 1, there's a married couple. In wave 2, they've gotten divorced. One of the spouses has moved out and then has a new partner living with them, then we would interview both the original spouse, the spouse who moved out, as well as the new partner who moved in with that spouse. So then all three of those people would be in the survey universe. And for original sample people who leave the household, we'll follow them as long as they remain in the survey universe, which is, again, the civilian, non-institutionalized population and in the United States. And that is denoted in this variable called THHLD status, or T household status. And so a value of 3 indicates people who were interviewed in the previous wave who have since moved out of the survey universe. And that can happen in a variety of ways. They may have moved into institutional group quarters, meaning that they might be in jail, they might be in a nursing home. They might also have moved into military barracks, or they're on active duty. They may have moved out of the United States, or they may have died. And for these people, we'll collect a limited set of information about them, and that allows us to impute records for them for the months that they're in the household. But of course, months after they left the household, they're set to inactive. Similarly, we have household status equals 4 people, and those are people who were interviewed in the household in the previous wave. They have moved out of the household, but we've been unable to find them. So they may be in the survey universe, but we just haven't been able to locate them. So these people get set to inactive, but they are available for selection on rosters of active people. And as I said before, those can be people who are, like, again, if you're saying, who does your health insurance policy cover? it covers me, and you can also select people who are no longer active as having been covered by you. So if you're doing research across waves and you want to link multiple waves of the SIPP, also think about which file structure that you need, because you could combine the files in a wide structure or you could combine them in a long structure. And ultimately, that's going to depend on what your analysis is and how comfortable you are working with data. This is somewhat of a consideration when you're working within a single wave, but it's critical when you're working across waves. And what do I mean by wide and long files? Well, a wide file is a file that has all of the waves variables put on a single record. So in other words, this is the January record for person 101. And you can see that their wave 1 age is 35, their wave 2 age is 36. So in other words, it's wide because it keeps extending out this way. You could keep adding multiple waves to this file. Conversely, you might want a long file where instead of going out this way, you join the 2 waves of data, and then instead of 12 person months, you now have 24 person months for a certain individual. So in other words, you would have 24 observations for each person. So we have given you some sample code how to do this. If you look at the Census Academy site, if you've downloaded the PDF that has the workshop slides that I'm going over right now, at the back of that is some sample code, both in SAS and Stata format, about how to create either wide and long data. And I thank Holly Fee for creating that sample code for us. Okay, so once you've decided all of that, you also need to keep in mind which weights you want to use, as we discussed earlier. You don't have to use weights, but we strongly suggest that you do. You may actually want to run your analyses both ways, both with and without weights, and just see how much it makes your estimates differ. Sometimes they're very similar, sometimes they change dramatically. But certainly for any kind of work that you're going to publish or any research that you're doing, say for a project, school project or a dissertation or whatever, we would definitely recommend that you use weights because that compensates for the way that the sample is designed. All right, so that is the end of some things to keep in mind with the data. Now just a couple of resources for you guys as you're participating in these webinars. As I mentioned, we have the presentation slides and sample code currently available. You can access it at the Census Academy site here. That's up there right now. Later on will be a recap of this webinar, but you can get the materials right now. If you want more detailed data, your best resources are these sites. There's the SIPP site, which is census.gov/SIPP. This is a great resource for all things SIPP. The Census FTP site is good if you just want to download data sets. And this third site is not a census-sponsored site. The National Bureau of Economic Research maintains a very, very good SIPP page. And they have a lot of data sets. They have the same data sets that we have, but they've converted them to other formats, including SPSS and Stata for panels prior to 2014. They also have a lot of good sample code and a lot of good frequencies and things like that. So, like I said, although this is not a census-sponsored resource, this is a place that we often send data users because it's a very, very good resource. As I mentioned, census.gov is a great resource internally. We have a lot of documentation that we've made available up here in addition to the data. There's a very good user's guide. There's metadata and the data dictionary, as well as some, very specific notes to think about or things to think about if you're using the data. We have a code book, and then we've created crosswalks if you've used the 2008 panel and you're curious about what's changed. These two crosswalks will help you compare 2014 and 2008, and you can get a sense of any updates you would need to make to your own code to run it on 2014. So that concludes our webinar today. I will remind you that tomorrow Holly is doing demographics and residences, and then later on in June we have another 5 or 6 webinars that cover the different subjects, including jobs and assets and so on. And certainly we encourage you to attend any of those that pique your interest. And that is it for today. Thank everybody for attending and listening to us. We'll have plenty of time for Q&A now. If you want to follow up with us later, you can send an email to census.sip@census.gov. You can give us a call on the SIPP line, or again, the SIPP website is there. So thank you very much. And we will now take questions.
Thank you. We will now begin the answer and question session. If you would like to ask a question, please press star followed by 1 and record your name clearly. To withdraw your question, please press star 2. One moment, please, while we wait for the first question.
I saw that somebody in the chat asked for the URL for today's slides. They are available here on the Census Academy site.
Marcus, do we have any questions in the queue?
We show no questions in the queue.
All right. Well, thank you guys very much. And again, if you have questions later that you would like to follow up with us directly, feel free to contact us either via email or on the phone.
I'm sorry, 2 questions have just popped up in the queue.
All right.
One moment. Our first question comes from Chad. Your line is open.
Hi. Early on in the presentation, you had talked about the limitations of analysis below the state level, and it was just a quick touch on it, and wondering if you could elaborate, or if that's something that's going to be in a subsequent session.
It's not in a subsequent session, so sure, I can talk about that. So for SIPP, the sample size is not such that it can produce reliable estimates below the state level. Plus, unless you've got access to the internal files, you're not going to have the geographic identifiers to do so. So we recommend that you use SIPP only for national and state level analyses.
Thank you.
Our next question comes from Danielle. Your line is open.
Thank you. Due to survey fatigue, are there certain portions of SIPP that tend to be skipped more often than others?
So we have looked at that, and it is definitely the case that people break off, but it doesn't. What our field representatives were concerned about, for example, was that because the nativity and citizenship stuff is at the very beginning of the survey, that was causing respondents to break off, and we weren't seeing that. And I haven't, Holly and Shelley can correct me if I'm wrong, but I don't recall having seen anything where there's like a general specific break-off point where we can say, okay, by the end of, for example, assets, people are sick of it and are done. It seems like the break-offs are spread pretty evenly throughout the survey. So I think, so my guess is that the respondent fatigue is more in that if it's a large household, we might get interviews for the first 2 or 3 people and not, people 4 to 6, as opposed to a certain person within the interview breaking off.
Mm-hmm. Thank you.
You're welcome. Are there any other questions?
We show no further questions in the queue.
All right. Well, thank you very much, everybody. We appreciate your attendance. We appreciate your support of SIPP and your interest in it. And again, if you have any other follow-up questions, feel free to contact us using the information shown here on the screen.
And thank you, Matthew, for a wonderful presentation.
Our pleasure.
Appreciate it.
Thank you for participating in today's conference. Please disconnect at this time.